Well, I did research during my residency in psychiatry on the so-called chemical imbalance theory of depression and anxiety. Yes. Probably a lot of people in Romania have heard this theory and perhaps believe it's true. But the research I was doing showed that the theory really was a false theory. It was not the cause of depression and anxiety. And I didn't want to spend my life studying a false theory. I had a grant to stay on the faculty at Penn. I had a 5-year grant to develop a brain serotonin laboratory. Serotonin was this chemical that's wrongly claimed to be out of balance that causes depression. And I didn't want to do it. And then I heard about this new approach called cognitive therapy that Aaron Beck was developing. And he had this theory that sounded stupid to me at first, like negative thoughts cause depression. And you can train people to change their negative thoughts. I said, that is so much baloney. And when I met him, he looked a little to me like a con artist. He didn't impress me at all. And I said, this is a fake thing. And then the department chairman said, well, why don't you just go to his weekly seminar and learn how to do this cognitive therapy and try it with your patients, and then you can satisfy yourself that it's no good. So I said, yeah, I'll do that. It'd be kind of like an informal research. And so I went to his seminars. I started using it on my toughest patients, and they suddenly started recovering. And I said, this is something fantastic, yes. And I think I want to spend my life committed to this cognitive therapy and other new forms of psychotherapy. So I gave up my grant, I left the university and went into private practice, but I stayed on the university. I still taught and kind of helped out, and I do that now at Stanford too. Powerful healing techniques are evolving in the area of psychotherapy. I've never been against drugs, but I never saw a tremendous beneficial effect of the antidepressants. They're based on a wrong theory. They're based on this idea that there's not enough serotonin in the brain, and that's why people are depressed. And that's not why people are depressed. And these things have powerful effect on the brain serotonin systems, but they don't cure depression in most cases. So that's the way the field is set up. See, yes. I'll diagnose your problems. I'll give you these labels from the DSM. Yes, so you have a major depressive disorder.
Which will depress you even more, knowing that you have those labels.
Exactly. You get kind of ashamed of your symptoms. Okay. And what I do is I make people proud of their symptoms and proud of their resistance.
And you change their emotional state by being proud.
Yes.
They realize they have value because depression is the devaluation of the self.
Yes. And we turn everything inside out or upside down, turn it on its head.
Feels good about herself.
Yeah. People go through a transformation. It's not just... It
involves the subconscious as well.
It's a total body experience, but it's more than a psychological change. It's like a spiritual change because you see things at a much deeper level. So that's how it works. And I've never been against medication. Sometimes they can be life-saving for people with schizophrenia or a manic episode who's psychotic and out of control. But I think that for most human suffering, depression, the anxiety disorders, the relationship problems people get into, the insecurities people have, that these are not problems that are going to be solved with pills, probably ever, but with powerful new forms of psychotherapy or growth for people, whatever you want to call it. I just absolutely love what I'm doing, but I don't prescribe drugs. So it's an entirely new way of thinking about depression and treating depression. I use a lot of power of suggestion. I've always been impressed with hypnosis, and I use a lot of suggestion. I use indirect suggestion when I'm doing therapy. And the woman that you saw on the video yesterday, is a very hypnotizable woman. And I sometimes wonder if when I'm doing therapy, people go into a trance.
I think there is a shift there that happens at in the dynamic between the conscious and subconscious.
Right.
and the subconscious becomes available and absorbs your suggestions.
Yeah, and there's this fusion between the therapist and the patient. You're not saying, oh, you're going deeper and deeper. You're not doing formal hypnosis.
But they're in a state of learning with you because they're like in school.
And absorption, because even when I'm working with someone in front of an audience, they say it's as if the audience isn't even there.
Yes, exactly.
That this is happening here between us, and I think that often has aspects of the trance state. I do think that the power of suggestion is important, but even hypnosis itself cannot. Well, hypnosis is not a therapy.
It's just a state.
Yeah.
Hypnosis is a state, and you need to use tools or
that's right.
therapies.
When a person is in a hypnotic state, you can sometimes work very, very rapidly, and I think in a way a lot of life is hypnosis.
Aren't we in hypnosis until 6-7 years old, until the conscious mind is fully formed? Isn't
that could be
hypnosis the state where the subconscious is open and receptive for suggestions? I received answers from my clients in hypnosis to what is consciousness, how the universe works, what's this connection between consciousness, brain, body, and the dynamic between all the levels of consciousness, that there are more levels than we realize. It's the conscious, we're familiar with that. There's the subconscious, we're not really familiar, we're not really understanding the complexity of the subconscious. And there's another level, that's wisdom you talked about today, that inner giant. That's the higher level of consciousness that we should align with in order for all the levels of us to function in that state of unity in consciousness from which you can indeed experience love and joy and happiness and create a beautiful life and a vibrant health.
Well, my book Feeling Good there, if you want to grab it.
Yes.
The little yellow one, grab that one. When I wrote this book was in 1980.
Yes.
And feeling good, cognitive therapy was considered quackery. It was like some new thing. Nobody believed in it. Nobody cared about it. No one had heard about
healing through the power of the mind.
And it was discounted. And then after this book came out, it sold now, like this one has sold over 5 million copies. This one is up nearly to 2 million copies.
Wow, this is the handbook.
Yeah,
good handbook.
And this put cognitive therapy on the map all over the world. But now I'm writing a new book to talk about these radical new techniques. And I'm hoping that will make the new team CBT well known as well.
Where would you like to see the field of psychiatry and psychotherapy going?
Where do I see it going? Well, where I hope it's going to go, I'm doing a paper tomorrow afternoon commenting I'm the commenter on a paper by Stephen Hayes. And he has come to conclusions very similar to conclusions that I've come to, and I'll just mention a couple things. I'm hoping the field gets away from schools of psychotherapy. Right now, what we have is we diagnose people with DSM in the research studies, and then we have therapists trained like in some form of treatment, like some school of therapy to treat, like cognitive therapy is going to treat depression, or some exposure therapy is going to treat anxiety, or ACT therapy, or EMDR, or psychodynamic therapy. And all of these therapies just come out the same in the studies and not very, very good. And I think it's time, and I hope, and why I think the field is going where it needs to go, is give up schools of therapy and focus instead on how psychotherapy works in the research. What are the methods that get people better? What are the processes that get people better? And teach those to young students. Don't encourage them to sign up for one of these schools of therapy. Instead, teach them the best methods from all of the different schools of therapy, and then how to integrate those methods for each individual patient, treating people as individual human beings. I think you do a lot of hypnosis. I think there's a lot of value. There's many great hypnotic techniques. I have 50 or 100 techniques, and a lot of them involve cognitive hypnosis. But that's one thing. And I think another thing, I think the DSM is created by the American Psychiatric Association. It's the Diagnostic and Statistical Manual of Mental Disorders. And I think there are tremendous problems with that, logical problems. It's absurd, really. They're trying to take human suffering and turn it into brain disorders that you could have or not have. Like when I talk to audiences, I say, now the most common brain disorder, according to DSM, is generalized anxiety disorder. And there's only one criterion for it in the DSM, and it's how many days of continuous worrying do you have to have before you're given the diagnosis of generalized anxiety disorder. It's after 6 months of continuous worrying on midnight of, let's see, there's 365 days a year, so that would be 182.5 days. On midnight of the 182nd day, you have a brain disease that you didn't have 5 minutes earlier. And so I think another direction for the field to go into is to change the way we think about symptoms and get away from the DSM, or radically change the DSM. There's nothing wrong with measuring symptoms, and I think that's very important with brief, accurate scales. But going from, my goodness, you're very depressed, to say, in addition, you have something called major depressive disorder, I'm very offended by that.
And aren't you negatively programming again the patient?
Yes, I'm the expert.
Yes.
You're defective, and I'm going to fix you with pills, or I'm going to fix you with this or that school of therapy. That's another thing. And a third direction I think the field is going in, this is something you probably are not doing in your clinical work, which
yes,
you could dramatically change your own effectiveness by doing it, but I believe that soon it will be required to measure things at every session.
I see the measurements.
Yeah,
yes,
and we have beautiful scales we've developed that we have patients take them in the waiting room before the session begins and in the waiting room after the session is over. And I can see exactly how much change there's been in depression, in anxiety, in anger, in suicidal urges for the first time. And that lets me know, was I wildly successful in the session? Was I unsuccessful? Was I somewhat successful? And then the patients rate me on how empathic and caring I was.
Yeah.
And that feedback will transform a therapist's life and career. However, it takes courage.
Exactly.
And many therapists refuse to do it because they don't want to be accountable. But I think that's another direction that the field must move into, to develop a science of psychotherapy rather than these schools of psychotherapy that compete like religious cults right now. But I'm in favor of brain research. PhDs who are trying to learn how the brain works, that will deliver tremendous, exciting discoveries in the future. And I think most people who are depressed and anxious can be treated very effectively and quickly without any medications. And I think that's good news.